Call the regular meeting of council order for Monday, January 5th, 2026. Before we do approve of the agenda, just want to recognize a few employees there. We did the Christmas parties and service award banquet in December. Just want to mention a few people. Call it Ernest is 10 years of service with the district. Al Gusky has got 15 years of service. Sean O'Reilly has 30 years of service, which is pretty outstanding, and I think it's really, really important to acknowledge those employees of Miss Scott's. And I was hoping the employees would be here, and we did reach out, but it's pretty hard to make them come, especially when they're still working and stuff. But I think it's important if council sees them on the street to shake their hands. But I think it's really important, or see them in the offices here, to see that kind of milestones, 30 years, 15 years, and 10 years with employees is pretty important. I think we need to recognize it as elected officials. With the fire department, I want to recognize them as well. Alex Murray with 5 years, Kevin Bossum 5 years, Kevin Pittman with 10 years, Adam Hall with the 1,000-hour club for training hours, and Alex, I don't want to mess his last name up. Does anybody know his last name? Barazanik? Thank you. Firefighter of the Year Award for this year. So congratulations to all those individuals too. It's pretty important when we see a volunteer fire department, when we got people with 10 years and 5 years and 1,000 training hours, it's pretty important. So I think we need to recognize that. Take approve of the agenda, please. Councillor Noxana.
That the January 5th, 2025 regular council meeting agenda be adopted as presented.
Seconder, Councillor Julik. All in favor? Carried. Adoption of the minutes for December 15th, 2025, special council meeting minutes, recommendation. Councillor Norbury.
Thank you, Mayor. That the December 15th, 2025 special council meeting minutes be adopted as presented.
Seconder, Councillor Noxana. Any errors or omissions from council? Staff?
No.
Thank you. Call the question. All in favor? Carried. December 15th, 2025 regular council meeting minutes, recommendation, please. Councillor Noxana.
That the December 15th, 2025 regular council meeting minutes be adopted as presented.
Seconder, Councillor Julik. Any errors or omissions from council? Staff?
No.
Thank you. Call the question. All in favor? Carried. December 16th, 2025 special council meeting minutes, recommendation. Councillor Norbury.
Thank you, Mayor. That the December 16th, 2025 special council meeting minutes be adopted as presented.
Seconder, Councillor Noxana. Any errors or omissions from council? Staff?
No.
Thank you. Call the question. All in favor? Carried. Any business arising from the minutes, council? Staff?
No.
Thank you. Okay, moving right on to consent agenda. Take the recommendation, please. Councillor Noxana.
That the items in the January 5th, 2025 consent agenda be moved for information.
Seconder, Councillor Julik. All in favor? Carried. Are there any items council like to bring forward for discussion? Councillor Norbury.
Thank you, Mayor. 7.8 for discussion, please.
7.8 for discussion. Seconder, Councillor Noxana. All in favor? Carried. Councillor Norbury.
Thank you, Mayor. So we do have a letter here from the Minister of State and Local Governments and Rural Communities. And I appreciate her reaching back out to us, but I think this might be an opportunity for us to send a letter back to her discussing the follow-up to the meeting that we had with her. Like when we were there speaking with Ms. Anderson, we talked about our issues with health. We talked about our issues with BC Housing, and I think that we should let her be in the know about what's happening with her healthcare. We have not had any forward movement in our dealings with Northern Health, and if anything, it's I think we're almost being insulted by not being engaged with properly. So I would like to motion that we send a letter to the Office of the Minister of State for Local Governments and Rural Communities regarding our continued issues with Northern Health and updated correspondence from the Premier.
Okay, seconder, Councillor Bertrand. Discussion. Councillor Norbury.
Thank you, Mayor. Sorry, I add a little bit in there, an updated correspondence from the Premier, just because the Premier sent us a letter regarding us formulating our own healthcare housing society to build nonprofit housing, which wasn't the case. I think it's important for us just to send that along to her. Like, by the way, we just like that corrected. Thanks.
Appreciate that. Any other discussion? Just ask that staff also tag our MLA. I think it's really, really important. We have a policy on that anyways, but that we're making sure that these letters are also going to MLA Newfield. It's very important to keep him up on the thing. I know there's, and I appreciate the motion. I'll support it. I have some other motions that'll be at the end of the agenda today. There's one there in regards to Northern House Board of Directors, so I have lots on them. Same thing, Minister of State and all them should be added to there too. So, any other discussion? Call the question, all in favor? Carried. Any other items council like to bring forward for discussion? Okay, I'd like to bring forward 7.3 for discussion. If we can get a seconder, Councillor Noxana, all in favor? Carried. I actually had this added to the agenda in correspondence. I think it's really, really important that, you know, it's there, it's in the agenda, it's everywhere, that if there is residents within the community that think that they know somebody, this is an opportunity for people to be nominated. And I do think we have those valuable residents within our community, and at any point that we can support that, I think that's an opportunity for sure. So that's all I wanted to say about it. Anybody else have any discussion about it? Okay. Any other item council like to bring forward for discussion? Okay. Moving on to appointment of external auditors. Report dated January 5th, 2026 from the Chief Administrative Officer regarding the appointment of external auditors. Recommendation, please. Councilor Norbury.
Thank you, Mayor. That council appoints KPMG LLP as the district's auditors for the 2025, 2026, and 2027 fiscal years.
Seconder. Councilor Noxana. Discussion. Councilor Julik.
Have we ever had KPMG as our auditors before?
We have.
Okay.
Yeah, it's been since 2019, I think, that we haven't used them. We've used another company. They were before, previous to that.
Before, yeah, okay.
Any other discussion? Call the question, all in favor? Carried. Admin 38 approved exempt events policy amendment. Report dated January 5th, 2026 from the Director of Community Services and Facilities regarding the Admin 38 approved exempt events policy amendment. Take a recommendation, please. Councillor Noxana.
The council adopts Admin 38 approved exempt events policy as amended.
As presented or amended? Do you need?
Amended is, as presented, sorry. Amended is what's in the report.
Okay, but as presented? Okay. Seconder. Councillor Julik, discussion? Call the question, all in favor? Carried. Admin 52 Recreation Pass Benefit Policy Amendment. Report dated January 5th, 2026 from the Director of Community Services and Facilities regarding the Admin 52 Recreational Pass Benefit Policy Amendment. Recommendation? Councillor Julik.
The council receives this report for discussion.
Seconder. Councillor Noxana. All in favor? Carried. Councillor Julik.
I liked the work that went into this, and I should have talked to Ms. Scott, but I'm assuming that if I want to see any changes, this would be the time to bring it forward. So I'm going to say, as I read it all, and I know when we discussed this previously, we talked about not having pharmacists on the list. And I think that because we have such an extensive, because we put that out to all the other health professionals, I'd like to revisit or refresh my memory as to why pharmacists have not been added. If we don't have a pharmacist, that hurts us when we have to be out of town for that. I know that our current pharmacist works extra hours to make sure that things get done. They're generally flat out. So maybe they couldn't even use a pass. But if it helps in their hiring, as we've talked about with the other recipients on this pass, I would like to see pharmacists added to the program.
Okay, you have to put it as a motion. I'll be honest, previously not added, it's a private business. So I think clarity from staff would have to be there because it's a private business. It's not run by government. This, like when we give it to Northern Health employees or the fire department or the RCMP, it's totally different than a private business. But you'd have to put a motion out there for them.
I would say the YMCA is also private or not for profit, but it's separate. So
Yeah,
anyways,
not-for-profit.
okay, fair enough. I would like to make a motion that pharmacists are added to our VIP program.
Okay, seconder, Councillor Noxana, discussion? Before I can vote in favor, oh, go ahead, sorry, Councillor Noxana.
Thank you. I seconded it so we can discuss it, but I think that this deserves being looked into, if this is something we can offer to the pharmacist in town or pharmacist in town, because I do recognize that this is a health professional we need in our community desperately. And if we're not able to give it to a business, fine, but if we're giving it to a professional working in our community, that's a bit different than giving it to a business to hire, I think. I'm interested to hear what staff or like the legal part of that would be, of what we're allowed to do.
Yeah, I appreciate that. Yeah, it'd be my comments before I can support it. I think we need to get an opinion of that, if we make sure we're not going against supporting it. And, you know, when it's given to an individual, maybe it's different, but pharmacists, it's ran by a, you know, they run a pharmacy. So to me, I think we just need to be, you know, whether this is deferred, the staff gets an opportunity to look into it. Because again, I mean, I'm all supportive of these passes when it comes to pharmacists, nurses, X-ray, fire department, the YMCA. Like I totally think that, you know, we need to make sure that, you know, to me, that's why it's there, in my opinion. I mean, there, you know, sure, there's a cost to the taxpayer, but what's that cost when you think about we still have to put water in a pool and heat it, whether there's one person in the pool or nobody in the pool. We still have to do that. So to me, I think we just need to make sure that we're not against the charter. So that'd be my only thing. Councillor Jilek?
I had a thought when you were saying that, now I think it's gone. Because I appreciate the motion being seconded so that we can have the discussion around it, like, as I agree with you there. Oh, I know what it was. If we can't offer, I guess, in part of that, then if we can't offer it to them free of charge, could we look at giving them a discount? Would that be the same or different? Okay,
Yeah, again, I think, you know, whether we defer this or turn it down and give different direction just for staff to get some information on it, to make sure that, you know, whether we can't do it and this is why, even if we give it a discount, we can't do it and this is why, or we can do it this way and this way and this is why we can. That'd be my opinion.
Okay. Oh, and I guess because the other question I had was, if we had, so we have mental health clinician, so in this then, if we're talking about specific, like if we're talking, because there could somebody come in and run their own business and be a mental health clinician. So should we have somewhere in here that only Northern Health staff within the policy? That would be something else I would want to ask staff.
Yeah, thanks. Councillor Noxana?
Thank you. My hope is that we can defer this. Do we need a motion to do that? To look into whether we can offer this to, okay, so I'm going to motion that we defer this until we can have more information on offering this to the working professional in our community versus the business, and what the charter says on that.
Thank you. Seconder on the deferral, Councillor Jilek. Any discussion on the deferral? Councillor Hoffman.
Thank you, Mayor. I'm not in favor of deferring this, just the timeline that we have right now with everybody else on the list and how much discussion's gone on this. I have no problem amending it in the future if we need to, or if we decide we need to. But I think there's a lot of people on this list looking to start at the end of January, and I do not know how long it would take to get a legal opinion, so I'm not in favor of deferring.
Yeah, I don't believe this holds up the passes for the individuals that have already been approved. This is just, this deferment is the motion to add pharmacist. Now, I'll be honest, a pharmacist that works for Northern Health, which there are, would be different. But my understanding with the motion that we're talking about, that was put on the floor, that now is being deferred, is for a pharmacist that has a business within our community. But it would not hold up the passes to Northern Health, YMCA, the RCMP, or anybody else. Councillor Bertrand.
Thank you, Mayor.
That's my understanding anyways.
Yeah, I definitely would be in support of supporting the pharmacists in this way. I think it's definitely a very good recruitment policy, but also it's showing our appreciation for the work that she does in our community. Above and beyond, I can think of the time when Sharissa and Dr. Helm put together a program to get people off of extra medication, mostly seniors. That was a fantastic program. I haven't heard of that type of an initiative in any other community, so I'm very much appreciative of the service that we have here. I'm just kind of curious on an option to give them. I'm sure the pharmacists have an association, and maybe there's a way that we can issue it to the association on behalf of the pharmacist instead of the private business possibly.
Yeah, and I think that gives staff a chance to look at it by doing this. Any other discussion? Call the question on the deferral. All in favor? Carried. Ms. Scott, just want to make sure that you don't need any other direction? Okay, thank you. Councillor Jilek.
So just to clarify, should we have in here that it's Northern Health staff then?
I think staff got that too. I seen them writing it down, so I think they're gonna look into that just to make sure with that health clinician, the mental health clinician and stuff that way.
Okay.
Yeah, and I think this here really brings a good topic to it and gives staff chance and it could be a quick response back, so that'll be part of it. Anything else in regards to the 52 recreational pass benefit policy? Okay. Moving on to airport land lease, report dated January 5th, 2026 from the Chief Administrative Officer regarding airport land lease. Recommendation, please, Councillor Noxana.
The council directs staff to negotiate a lease agreement for a portion of land within the existing boundary of the Tumbler Ridge Airport with Colin and Leah Rosengren.
Okay, seconder, Councillor Jilek. Discussion? Call the question. Oh, hang on a second. Councillor Hoffman.
Sorry, Mayor. I was wondering, I don't know if we even looked at it. I got that we're not interfering with any of the current services, especially for forestry, the firefighting stuff. Has this ever been brought up before, the request for a private lease on the airport? That's not the right one.
Keep going, Councillor Hoffman.
No, sorry. Like, I just don't have a sense of what the airport looks like and like where a hangar would fit in and how many hangars would be available. Have we gone through like a process of really seeing an airport expansion? And I was wondering if there was a like map of airport with that sort of idea and where that would sort of fit in. Like, I don't have a sense of it. I know it's overgrown, but I haven't really been through it. But if not, I'm not planning on holding up. I just would love a visual.
Yeah, we could have staff get a map at their earliest convenience and put it on our wickets. But yeah, if in the report it talks about all the stuff they've actually already pre-done before this is put in front of council, reached out to different organizations, looked at other different plans and stuff to make sure that it would fit. So, but for map-wise, staff can get that in front of us. Yeah. Any other discussion? Call the question. All in favor? Carried. 9.5, 2026 Local Government Leadership Academy's Annual Forum. Report dated January 5th, 2026 from the Executive Assistant to the CEO, Mayor, and Council regarding the 2026 Local Government Leadership Academy's Annual Forum. Recommendation, please. Councillor Jilek.
That council receives this report for discussion.
Seconder, Councillor Noxana. All in favor? Carried. Councillor Jilek.
When this came into our email or when it came across my notice, I took a look into it and I feel like it might be a good opportunity for one or three of us possibly to go and see what it's all about. I appreciated the name of the conference, the Finishing Strong, Legacy, Leadership, and What Comes Next. I think that, as members of council, whatever information that you can get that will help you be a better leader and help you understand maybe staff and stuff is good. Anyways, I would like to go, and which is why I had brought it forward previously. I just think it's a good idea, and I think like the AME conference, we didn't know what that was about until we went, and that's been something that we've continued to look at going, and I think this is an opportunity to see something that's out there for us as council and have a report come back.
Thanks. Any discussion? Okay, Councillor Bertrand.
Thank you, Mayor. To be honest, I'm not really in favor of anybody going to this one. I think this one is more, from what I recollect, I believe this one is more geared towards staff. But I'm curious on our travel budget. I've heard rumors that our council travel budget is, we're way over, so I'm curious on whether or not that's the case, and if that is the case, that confirms my my opinion on whether or not we should go.
Ms. Scott, would you know, I know we're over from the 2025 budget, would be my understanding. This would be qualified under the new budget. When we went through the budget process in 2025, I don't think we were given, I don't think we had all the true facts or true acknowledgements on some of the council's budgets before council started cutting things. I think some of the GLs weren't listed properly so that we knew on some of the funds that we were using where they were being GL'd to. So I think when we made some cuts trying to get down to the mandate, we made cuts in our budget for travel, which is appropriate, especially when we're told, oh, you're budgeting this much, but we've never used more than this. But that was actually false, is my understanding. Is there were some GLs moved around, and so we didn't have all the true information. So council had cut the budget, which why wouldn't you when you're not using that money? But previously, it sounds like we actually did it, was just maybe put in the wrong GL lines. So do I think we're over our budget this year? I do, or in 2025, my understanding, our travel budget for the elected official was. I know, I'm not sure if I have all the final numbers, but Ms. Scott?
I don't have the final numbers, but yes, council has spent more than what was budgeted in 2025.
Thank you. So we don't have the finals yet. And I know we're over, and I'll be honest, we've actually had other motions out where we, I won't say pretty much a blanket, but fairly close to a blanket travel for healthcare. So any meeting that came up with healthcare, whether that was Prince George or into Victoria, you know, it was pretty much anybody could travel for that part of it. And then obviously, like I said, we cut budget thinking that we weren't using a certain amount, and it was not true. We were actually using majority of it. So we made cuts that maybe we wouldn't have if we would have had all the information. Councillor Julik.
Just to follow up with Councillor Bertrand, it says on the, because I honestly, I don't know, I've never done anything but research it since this last time, and it says that it serves local government and First Nations elected officials and senior administrators. So I think for me, that's what I was looking for, with the hope that just even to understand the Municipal Act and stuff a little bit better. Like, you can read it all you want, but if you're not figuring out that government speak. So that was my thought for going. But I also see that they do have certificate programs, which is something that I could do as well. If council would prefer to go that way, I'm okay with that as well.
Okay, any other discussion? Okay, motion needs to be put on the floor if you want to discuss and voted. Does anybody else want to travel to the LGLA? So right now it would be just Councillor Julik. I don't know my travel or my schedule, but Councillor Julik.
That the following members of council be identified for attendance at the Local Government Leadership Academy Leadership LGLA Forum to be held March 11th to 13th, 2026 in Richmond, BC, with costs coming from council's travel budget.
Thank you. Seconder, Councillor Noxana. Discussion? Call the question. All in favor? Opposed? Motion's defeated. Schedule of meetings and events. We have the workshop this Saturday, budget workshop for council. Do we have a start time, Ms. Scott?
1 p.m.
Thanks. Couldn't remember it. So for all the council, can I tell you, I know there's some people that have other things in their schedule. We are going to try and get some of this stuff at least discussed and talked about, and try to move some things ahead, as we're already well into January, and budget is going to come very fast without any meetings so far. There's also a workshop on the 12th of January at 4 p.m. That's the Let's Talk one that we talked about, so we've moved it in here. This is one. It was mentioned about, oh, how come we don't talk about Let's Talk after we have the Let's Talk? Here it is. So that starts at 4 o'clock, and obviously the meeting at 5. And then the Winter Carnival, so I appreciate staff getting this in there. Anything else from council in regards to January? Okay, I am going to put a motion on the floor to remove the regular meeting of council on January 26th. If I can get a second, I'll explain it. Councillor Noxana, discussion. I'm putting that out there. One, I'm away. I understand that our CEO may have some conflict within the schedule. So that leaves two of us out. So if we need a meeting, we can always arrange a meeting. I believe we're going to have multiple meetings coming up in February when it comes to budget. So I think we'll make it up. Okay, I'm going to call the question. All in favor? Opposed? Councillor Jilek's opposed. Motion carries. Anything else for council for February or January? Anything from staff?
No, I was going to highlight the budget workshop on Saturday and the Let's Talk workshop on the 12th, but you already mentioned those, so there's nothing else.
Thank you. Any notice of motions? Okay, councilor's business. I didn't do a report, but I kind of wanted to highlight the Northern Health Board meeting. So I made sure we kind of, put it somewhere within the agenda so that council, one, it would stick out and we can have a conversation about it. I do believe, one, I appreciate being able to go to Prince George for this meeting with the board. I think it was worth it. I appreciate other councillors attending as well as staff. I'll be honest, we drove through probably one of the worst snowstorms I've driven through in the Pine Pass. It should have been an opportunity. I traveled with Councillor Norbury and our medical advisor. We were trying to see if we had reception to actually get a hold of the vehicle behind us to tell them to cancel and turn around. It was that bad, and we still traveled. I do not believe the board listened to us, reading the response from the chair. I do not believe the board actually listened to the asks of the delegation. To me, there was 3 asks that came from it. I made the 3 asks, but to me, that comes from the delegation. It all went, which was on behalf of the community. One of them was to redirect a doctor that is going to Fort Nelson in February, redirect that individual to Tumbler Ridge, as he's going to Fort Nelson with no patients. At this point, Fort Nelson is full of doctors, and they're on a fee for service. So fee for service. So he has to have patient contacts to bill it back to the health authority. They're not on the APP program. With that clause, I said when Fort Nelson, there is some talk that some doctors will be leaving Fort Nelson come summer or whatever, but when they needed them, the doctor could be reverted back to Fort Nelson. That's not been answered in here. The other question to the Northern Health Board was to immediately acknowledge that we're going to reinstate the after-hours on-call model for Tumbler Ridge once you tell us how many doctors we need to do that. If that's 1, that's 2, that's 3, the DTR put their money where their mouth is, let's get this moving. That has not been answered in this letter. Now, if anybody else that attended could tell me the third one, it would really help me out. I know there was 3, I just can't remember it. Councilor Norbury?
The addition of Vera.
Oh, thank you. I knew there was something else, but there might be 4 then. Yeah, there might be 4. And Vera. So there's some stuff that has not been, to me, answered within their response letter. Ms. Scott?
And another ask was allocating the unused PRA from Fort Nelson to Tumbler Ridge as well.
Yeah, thank you. Thank you. So, yeah, so I'm all aware there's a PRA seat, and please don't ask me all the acronyms. We should have brought our medical advisor for that to the meeting tonight. But there was a seat for spring 2026, which means the individual would be able to start in the fall of 2026 in Tumbler Ridge. That PRA seat, my understanding, Fort Nelson did no interviews, so that seat was going to be left empty. So we were asking for it. They didn't answer it in here. I don't know if that seat was filled. Don't know yet. I have a bunch of motions that I'd like to put on the floor, but don't want to second them at first, and that's not really the right way of doing business at a council meeting. Just want to make sure we're not missing something before we second it, because again, there might be some other intel or thought process from the rest of council, even the staff. My first comment or my first motion would be that we'd direct staff to send a response back to the chair of the Northern Health Board and all the directors of the board, asking them to answer those 4 asks. 1, reinstate our after-hour emergency on-call model once we have the amount of doctors that are needed by Northern Health. We need the number. The other ask was to redivert the doctor that's supposed to be going to Fort Nelson with no patient contact is what we've been told. So we want to reply for that. The PRA seat, if it's still empty, why can we not fill it with somebody for Tumbler? And what was the 4th one? Jesus. Sorry, Vera. So staff knows that one. Anything else in there for now? I have some more yet after this one's done. There's still more to come. Is there anything anybody else can think of after you've read the letter? response to the letter, or response to us, I guess? Councilor Norbury?
Thank you, Mayor. I mean, if we're sending a letter back in regards to the content of the letter, I have comments, but if you have other motions that address that, I'm happy to wait till that time.
Yeah, if it doesn't, if those don't, then we can do another one. Like we can do, like, what are you talking about, sorry?
Oh, I just wanted to comment about some of the contents of the letter that is false or misleading. You know, we had Dr. Helm send us a response letter as well, highlighting his concerns.
Yeah. Yeah, we'll do a second motion for that one. Or a third. Councilor Julik?
I was wondering, like, so as they talk about concerns about a breakdown in communication, I would like to see them give us something specific that they will reach out, whether the chair will reach out to you as the mayor monthly or something like that. Like, to me, yeah, we realize it. Okay, what are you going to do about it? Like, are you just going to put it in a letter? I'm not necessarily comfortable with that. We're committed to doing our utmost to ensure that the dialogue, what does that look like? I don't know. I'm just thinking and wanted to toss it out there as well. And I'm guessing that wouldn't, as I'm talking about it, I'm realizing this is specific to a letter going back. So I'm just going to stop talking. But that's something that I'd like to see what you think about.
Yeah, I marked that as a highlight. Councilor Hoffman?
Thank you, Mayor. I think not answering is part of answering. I don't have a problem with sending another letter, but I have no reasonable reason to believe that they're going to answer a question of how many doctors before and then consequence. There's no committal here at all, other than we're committed to keeping emergency as a ambulance response. That's pretty much the letter to me, is that's our committal. Primary care on on weekends, I mean, that is better than what we have right now, but there's not really a addressing of needs here. So I guess the short answer is, what would be the purpose to your mind of a letter? Or is it just you want to be specific and have it clear responses for these four things, and a non-response to a direct question is accepted as a non-response going forward?
Yeah,
Is that
so,
fair?
true enough, but then we'll add, the Minister of Health, Premier Eby, Minister of State, or MLA.
Okay,
To the letter, this letter is going to go out to all of them. I'm assuming we're going to get a response back.
okay, no, I appreciate
Right?
that.
I haven't added that part. Like, everything we send right now is going to be going to all these people as well. And everything that comes out of this should be going to the Minister of Health, the Minister of State, Premier Eby, RMLA. Maybe we're going to get some feedback here very quickly.
Okay, no,
To me, they're isolated us, and we're in a bad position right now.
Okay, I appreciate that, because that makes it a whole lot clearer for me, that
Sorry.
the questions are for not really Northern Health Board, it's board, can you answer these questions for everybody that's a stakeholder at this point in time? Thank you, sir.
Yeah, no problem. That's why I didn't want it second, so we could discuss it, but that will be where the letters go to, is the Minister of Health, Premier Eby, Minister of State, and our MLA. But I'll be honest with you, the board is what gives direction. The board is the elected officials. They're not elected, they're appointed by the Ministry of Health. So to me, they give up direction to Chiro, who takes and goes and does stuff. So to me, give us the information we need so that we can assist you on the recruitment side. Let's get our ER after hours back open. I'm not saying that primary care is not important like they say in here. Sure. How well is primary care working for them right now? Okay. Any other discussion before I get a seconder? And of course, Ms. Scott, we'd like to add all those, the Minister of Health, and I apologize because I did talk to Ms. Scott earlier, so we'll make sure it's added every time. Can I get a seconder for that motion? Councillor Noxana. Okay, and I think this gives us, before we second it, then we're not doing amendments. I know that's not the right way to do business, but when it comes to this here, I think we just need to make sure that council gets a chance to weigh in. Any discussion in regards to that motion? Okay, going to call the question. All in favor? Carried. The other motion I have, because they're relying on BC Ambulance, that we direct staff to send a letter to BCHS, the Minister of Health, the Minister of State, Premier Eby, and our MLA, asking for the following information from BCHS. Since we've asked multiple times, we are now doing it as a motion. I would like to know, or council would like to know, how many times have we not had 2 ambulance men within the district of Tunbridge? How many times have we had an ambulance go out of our community to cover somewhere else? And how many times has the ACP car that's supposed to be in Dawson Creek has not been manned? Before we get a second, or anything else from council? Councilor Norbury and then Councilor Hoffman.
Thank you, Mayor. I'd like some information about regarding the driving times in winter conditions to Dawson Creek. The reason why is I heard from a resident who it took 2 hours to get to Dawson Creek with their child who is suffering from breathing issues.
Yeah.
And that is 100% not within the golden hour or 90 minutes that is mandated within, which we believe is expected service. Excuse me. I don't know if I should say mandated or not. I'm not aware of those statutes, but yeah.
So in that same motion, if we can ask for the same information, hourly track time for departure of Tumble Ridge to the nearest facility being transported to from November 2025 to January 1st of 2026 for each and every transfer call. Work? Okay. Councillor Hoffman.
Well, Mary, you just covered what I was going to ask. I was going to ask to put a time range on it, as you didn't have one in the opening. I would suggest doing specifically November 1st till whenever it's actually done, just to make it as wide as possible, well, not as wide as possible, that when this was effective. Do we not want to go back to when they actually put this in September?
Yeah, so I'll be honest with you, the hourly track time for transfers that's the timeline. The other one would be from September 7th.
Okay,
So it could, just because we're talking about bad weather, I believe it's Councilor Norbury's concern is after we get our snowfall.
no, okay, so that's what I was,
So it'd be two different timelines, like the timeline, so I'll be honest, Ms. Scott and I, we never hid that from the council. We've talked about that. We met with BCHS. These are the criteria or information that we asked for. We asked for how many times the ambulance was not fully manned in Tumble Ridge, whether ambulance 1 or ambulance 2. We've asked multiple times how many times the ACP car was not manned in Dawson. We're not getting any of that information. We've asked and asked and asked. It was one of the questions that was asked at Northern Health Board of Directors, if they've given direction of BCHS not to share that with us. So somehow we're not getting the information. So that's why I'm putting it on the floor now that it's a motion from council. But that main motion of when the ambulances have been filled or not filled would be from September 7th. To me, Councilor Norbury's would be from November, just because that's when our bad weather hit. We can do it right from September 7th too. I mean, that's not an issue if that's preferred by council. Thoughts, process? Councilor Hoffman?
I just didn't hear the dates for the first group and when we're counting for. I don't actually have a problem with going back to September because I wouldn't mind seeing what real ambulance times look like on okay weather. But in the end, I'm not married to it because the concern really is what happens when something goes wrong. Like, I don't know, maybe an ambulance going off the road and getting stuck and having the secondary ambulance have to come out and take a patient out in, I don't know, minus 20 or minus 25 weather. Like there's just issues going on that are beyond how it's supposed to work on paper that I don't think they're being acknowledged, much less addressed.
Yeah, so we'll just move them both to September 7th. I mean, that's why we haven't seconded the motion, and I'm fine. And that's good. I just figured we were trying to track the bad time, but it doesn't hurt to track the good times. I don't think it hurts to track at all. Councilor Norbury.
Thank you, Mayor. We're kind of throwing a lot into this one, but my other thoughts would be getting the information regarding from time of call to 911. And the issue is that when we're talking about the hour of care, it's not just from the ambulance gets there or after the call starts, like the wheels start moving. It's important for us to get information about when the call comes in to when they get to the hospital in the destination, because that could be a big difference, right? Like I am aware that it's on average 8-minute mobilization time from the time they get called to the resident. How much time are they spending there analyzing it? And fair enough. Like, I'm not saying that they can't do these things, but realistically, if we're adding if they come back saying the average drive time to Dawson Creek is 72 minutes, well, they may be ignoring the fact that they spent 10 minutes analyzing 8-minute mobilization, and that 72 minutes now became 90.
Yeah, so when you track times on their GPS units, it tracks from the time they call out.
Thank you.
So that's what I was looking for. No, that's what I'm looking for. It'll be right from their data head. From the time the call goes in, it goes in on there. So they get, now, Tumble Ridge might be running a bit different. I don't think they are. And I can get clarity on that too. But we would get a phone call. So when I worked full time, we get a phone call on the phone at night. During the day, it was through our radios. At night, you get a phone that would ring. But by that time, you've answered that phone, and the data head's already beeping at your call sitting on the data head. So you're already acknowledged that they're dispatching you to a yellow or a green or a red. So that would be the track time. And it's to me, my understanding, and in our mountain range, sure, they're going to lose some track times here and there. Still going to have departure from here from the call out. So whenever they're called out, to whenever they arrive in Dawson or Fort St. John or Chetwynd, once they pick up the data head. So, anything else that we can think of for BC Ambulance? And the reason I'm doing this is, one is we asked Northern Health that exact same question, is BCHS was not sharing information with us. Have they been directed not to? Right now, to me, it doesn't seem like we're getting the information. I think this is a way of trying to get it, and if we don't get it, I'll be honest, I think, there's other avenues if they're not going to start sharing the information, and start reaching out to the news channels if we have to, and that's my personal opinion. So, okay, I'll take a seconder on the motion. Councillor Norbury. Discussion. Councillor Norbury.
Thank you, Mayor. I just want to talk more, like you commented, like we've asked this in the Health Task Force meeting as well. And Northern Health has given us the shrugs, right? Like we don't know. And, I want to believe in the best in people, but realistically, we're in a scenario where Northern Health is entrusting our residents' safety to BC Ambulance, and they have a perfect scapegoat of like, well, we're not, sorry, we're Northern Health or BC Ambulance, we can't tell you, right? Well, we need to know. Right? And I'm concerned about that pointing the fingers game of, the lost in translation scenario, and we need to know. So thank you for bringing this forward.
Thank you. Yeah, and that's my comments. Like, this is nothing against our paramedics. It's nothing against our nurses or our doctors that are still here. This is, I think that's going to be said loud and clear from the elected officials' side. So this isn't against the staff, the frontline staff that's working their butts off and doing all they can to make sure we actually have some kind of health care, whether that's after hours and a BC Ambulance has to show up, or in the fire department and whoever else, and get us out of this community. It's nothing against them. This is against government and the other agencies that work for government or under government. I just want to make sure that loud and clear from my side. The other concerns I have, and Councillor Hoffman had already brought it up, we are now putting, okay, maybe we aren't. Northern Health is using BC Ambulance as another level of healthcare because we can't keep a model open in Tumblr. To me, that we're putting not only our residents' lives at risk, but we're also putting staff that work for BCHS. We did have an ambulance that drove into the ditch yesterday, what's today, Saturday afternoon, about 4:45, with a patient on board. Second unit was dispatched to pick up the crew and the patient that were on board, and then transport to whatever facility they were going to. So that is a concern. They were close to town. I did go out and take some pictures just so I had them. Fairly good location where they went in, so great that was a spot. But what happens if it's a worse spot and the ambulance flips? Or, like, we're really putting, to me, Northern Health is putting staff that work for BCHS, another government facility, as well as the patients or our residents and the family of our community. And that's my concern. Maybe these people would not be being transferred out because they could see a doctor here and they didn't need to go. They still might need to go, but we're putting more and more people out on the highway anytime after 7 p.m. and all 24 hours throughout the weekend, Saturdays and Sundays, and holidays. We're being forced to do it. Northern Health was supposed to come to the community, can't remember the date, in December here to have a meet and greet or whatever. They canceled due to weather conditions. Kind of comical, right? They had to leave early because they flew. They didn't even drive from Prince George. They flew because they want to come to the Pine Pass in a vehicle. But they expect us to drive to outside for healthcare. So I think it's important. I think it's important that we stand up for our frontline workers, for our paramedics. Because they have a job, and to me, I don't think they don't get a say that, geez, I don't know if I want to go tonight. So I think this helps get us the information, and again, seeing all those organizations, adding all the ministers in our MLA is so important, so important to this. Any other discussion? Okay, going to call the question. All in favor? Carried. I don't have any more right away. I got to think about my other ones. I just want to mention something to Councillor Juick, and that was about the communication part. The communication that they're talking about would have been when they went from a closed meeting with councils, the elected officials, to an open meeting, or open to the public, talking about what happened. So we were in a close. They talk about a different possible change to a model to we're closing down the after hours ER. That's what the communication breakdown was talked about in this letter. Councillor Juick.
Thanks for that. As you're holding off on your next motion, I think my frustration as I sit and I listen is this all started with we're shutting down emergency care because we don't have enough doctors, and this has morphed into something so much bigger, and that's a super frustration for me because I think they took it from we don't have enough doctors and that's why we can't have after hours emergency care in person to now there's all these other pieces, and they keep taking, in my opinion, they're keep trying to slide the focus over. And to me, that's where I would like to go. Where in all of this, when they came to the public, they still made it sound like it was all about the doctors and they wanted to go to this other system. So to me, they've not been open and honest from the get-go. And for me, I'd like to put their feet to the fire a little bit and say, okay, this all started because you said we weren't staffed. And then now all of a sudden it's gone to this. Can we go back? We were told very clearly from, I can't remember her name,
Lisa Zenta?
Lisa, that it was not going to affect our budget. She said us plainly in that meeting, you follow up, you'll see that we haven't changed the budget whatsoever. So if the budget isn't going to be affected and all it needs is doctors in the building, but yet all of this communication that's been coming since, it's never refers back to that. It never refers back to that. And so for me, I would like to hear why this has changed, why that conversation piece has changed, and why they haven't come back to talk to our people. They say in here that their big deal is about the primary care, and I agree, primary care is important. We are a mining town. Most of our folks, they aren't getting primary care, they're getting after hours care, because they're working different hours and stuff. So, and for me, that's the most important piece, is we have an industry that is 24 hours, and I know that we've all talked about that before, and so it's not anything new. My frustration is I read all of this, and the other things that they have put out is they never go back to, we're just short doctors. They put it all on all the other things, and I appreciate the BCEHS stuff because, yeah, to me, they're absolutely ignoring, in my opinion, at the open house, they kind of downplayed our concerns around ambulances, and I would say we've had 2 or 3 or 4 instances that we could prove since September that we've been fortunate that we've only lost 1 life, that there hasn't been more. So I get that we could get those stats from BCHS, and it's difficult when people don't always want to necessarily share their personal health information, and I absolutely respect that. So we don't always have the exact stories to go with this, and I would ask everybody on that Northern Health Board how they would feel if it was their loved one that was put at risk, because that's what we're doing. And so for me, I know this is a long way to go around it. My point being, I'd like to find out why we have gone away from the conversation around staffing our clinic. And it's all about all the other things, because that's, to me, not what it was to begin with, and they have never said anything since there besides you have 24-hour care, when in fact we don't, as Saturday afternoon would have shown, when you had 2 ambulances out and about. So I don't know if that's a motion or if that's just some information I could offer to you when you're able to have those meetings with the folks that matter.
Yeah, well, the folks that matter, they actually have to answer to all of us as elected officials, not just the mayor. Just make a couple comments before I go to Councillor Hoffman. Northern Health will be coming as a delegation to present to the District of Tumble Ridge. I believe it's going to be first meeting in February. It could have been a bit earlier, but we have some council that's going to be away at sessions and conferences, and I think it's important that every elected official has an opportunity to be here. So if we advertise what the date is, and Ms. Scott will know the date here soon, that hopefully we can all make sure it fits into our schedule during a regular meeting or a P&P, that we can all hopefully be sure that we're here and be able to voice our concerns. My biggest concern, I guess, when we talk about, their response about primary care, that's great. So they had an open house that, to me, was well-organized, well-governed by the elected officials and other community residents. I think gave an opportunity for Northern Health to hear the frustration. They didn't like the outcome of that open debate. They came back and did this table concept. You had to register. They haven't been back since. So, they heard from a few residents, which, yeah, some residents are saying, I got to wait 6 weeks for a doctor's appointment. So right away, they picked up that from 3 or 4 or 10 people, all primary care. I'm going to just worry about primary care. Don't worry about anything else, just primary care. Well, I know of a few people in this room that almost died because we didn't have an after-hours model. Would it have been different for the 2 individuals? I don't know. Obviously, I'm still alive, so I didn't die because of it. But would I have had to have gone through what I had to go through? I don't know. Because I probably would have went down and hoped to see a nurse. I didn't get an opportunity to do that. So how many other residents are going through that same thing? But they haven't been back. That's my other problem, is they have not come back and communicated with our residents. They're trying to communicate with this newsletter, because, of course, the district has done one, so they must have got that from us that they should do this in Tumble Ridge, and it works. Because we do the Ridge report, now they're doing a medical one. I'll be honest, the last one, I held off a lot. I got reached out by the media lots. I held off a bit, hoping to wait for this board dance, because I didn't want to fluff any feathers the wrong way, and maybe this reply was going to come my way and it didn't. So that obviously, I should have done the right job and still hammered them on their notifications that they came out with. But again, this is a mandate to me about healthcare for all British Columbians. That's been set as a mandate from the province. So to me, one, they need to start coming back and communicating with their residents, not on social media. Not every community member in this community has Facebook. Not every community member here understands or has the technology or technology available to them, but they're not coming back. They've come back. They've been here in this community twice, and I think that should be a mandate that they come back. I know they're going to be coming to the elected officials to give the presentation that I'd already seen, and I think it's important for council to see it, but I think it's time to, again, we need to hold their feet to the fire. We should be demanding that they come back and communicate with our residents. It's, we're doing the best, and I'll be honest, I think council, the district staff, residents, I can mention, some of the residents I've seen on Stu Bell and Rhonda Caitlin, thank you. Some of these residents, I mean, they're doing it just as great as a job, trying to hammer them, keeping it up and trying to get the information. So, that's what we've got to do. But same aspect, they're not communicating back, and I think they need to come in person again. I don't think we'll ever see an open house like we've done. It will be those table things. I think they feel that they get more out of it, and that's their choices of an organization. I don't think that you're getting the same realm, because to me, listening to what the board is concerned about is primary care, and I'll be honest, primary care hasn't changed in Tumblr. It's still a 7 or 8 week wait to see a doctor, so that hasn't changed. So, Councillor Hoffman and Norbury.
Thank you, Mayor. And as much as I'd like to think Councillor Norbury's right and think the best of people, unfortunately the actions and words have not been there. So to try to directly answer your question, Councillor Julik, from my perspective and what I've seen in their actions and what I've heard from them, there is absolutely no intention to get to a doctor level to restore the model that we had before. And I'm not even committed to that. I'm open to other models that we can discuss. But the talking point of Tumbler Ridge still has emergency care, you just have to wait for an ambulance and drive out of town, but somehow that's equivalent to having in-town care, I found ridiculous from day one. And the gall to continue to push that talking point when, I'm sorry, maybe there's a legal basis, but in plain English, having emergency care in Tumbler Ridge is not the same as taking residents out of Tumbler Ridge to go get care, especially in our, let's be generous and call it 6 months of winter. And the point that I really am upset about is the focus on the budget. If you are putting this new model at the same price as the old model, what's going to happen when you add those fictional doctors that you pretend that you're looking for us, to your budget? So I'm sorry, the corporate actions here are grotesque. The talking points are ridiculous, and we've been polite in trying to engage them in what we want, which is the doctor question that you're bringing up, and they would rather engage in things like, finally, we firmly believe that the focusing on improving overnight ambulance coverage, including expanding the number of ambulance and response capacity, answers our question of having emergency care in Tumbler Ridge. It doesn't. We're not talking to each other. We're being talked down to. I'm sorry. That's what they've done since September. And I get frustrated in this conversation. I apologize. I shouldn't get this reactionary. But I have not seen a change in attitude. The most we've gotten is we might consider primary care on the weekends, and it's been most of September, October, November, December, and we're into January. So, no, I'm sorry. Your actions tell me you have no intention of recruiting. You are not using Dr. Helm as a resource to recruit. You are not changing the issues we've brought up with recruitment on the website. You've somehow spent the budget the same with half the doctors, and now you're going to tell me you're going to add some doctors. That's why we're not talking about it, and that's part of my continued rise in blood pressure, which I shouldn't do to myself anyways. So I hope that answers what you were talking about, and I'm going to stop now.
Thank you. Councilor Norbury.
Thank you, Mayor. I don't think there's anything wrong showing some emotions, Councillor Hoffman. I mean, we're all feeling it the same way. We're just expressing it different ways. Realistically, Northern Health is going to sacrifice Tumbler Ridge for the rest of the province. Right? They're afraid that if we get a doctor, that means one doctor they won't get, or one doctor that Dawson Creek doesn't get. They're willing to sacrifice us for the needs of others. And unfortunately, We can't agree to that. I don't agree to that. Our residents don't agree to that. You know, their approach to how they offer medical services in our community is something that our community has strongly opposed. They talk about wanting to build the foundation of primary care as a building block. We had 1,854 residents of our region say we need emergency care. So that's contrary to what they believe is in our own best interest. Again, talking down to us. Councillor Hoffman, good comments. You know, I believe they're negligent in their duty to our community. You know, I've heard from a parent. Can you imagine your child is having respiratory issues? You know, their 2-year-old child. It takes 2 hours to receive medical care, just to get to the hospital to receive medical care. Not knowing if that is going to be your child's last breath. I don't think I should be using somebody's personal tragedy in this, but I think it's something that has happened, and it's realistically going to happen again. Yeah. They're playing with their lives. Our community knows what's best for ourselves, and we've advocated for it. Not just ourselves as local officials, but as our residents putting forward that petition to the Minister of Health. It's a slap in the face to tell us what they think is best for us, when we already know. When people's families are potentially torn apart due to their negligent actions. I truly believe we're approaching a point when this does reach that critical moment when another life is lost. It is criminal. I have another motion, but I need to compose myself a little bit.
No problem. I'll carry on. I'm going to put another motion on the floor. You okay? We'll take a 5-minute recess. No, let's take a 5-minute recess. I'll give you to stand up anyways. We'll take a 5-minute recess. You want to do your motion first? Councilor Norbury?
Thank you, Mayor. I appreciate all of the letters to government bodies, but I think we should be crafting a letter in response to the public in regards to this. So I'd like to motion for staff to work with the mayor and our medical advisor to craft a public response to this letter.
Seconder, Councilor Julich. Discussion? Call the question. All in favor? Carried. Thanks for that motion. Another motion I have is, not sure if it'll be to the Board of Northern Health or Northern Health, but we'll just mention everybody again. So the Board, Northern Health, Minister of Health, Minister of State, Premier Eby, and our MLA. There's a PRA seat for this spring of 2026 that was left empty due to Fort Nelson not doing interviews for doctors. I'd like to know if that seat was left empty. If that seat was left empty, can we get a reason why? If it was not left empty and was filled, what community filled it? If I can get a seconder, Councillor Noxena. The reason I put that motion on the floor is I'm well aware that there was a PRA seat. I know Councillor Norbury sat on through the health task force. You sat and tried to sell Tumbler Ridge on when you guys interviewed through some physician positions coming from other countries. We had a doctor reach out from South Africa. I did a Zoom interview, I shouldn't say interview, a meeting with her. It wasn't an interview. She wanted to meet who we are and hear about the community. She wanted to meet with our medical advisor, our CAO. And then I heard that she was having some issues there with Health Connect, so we worked through those concerns. Minister Osborne was gracious. I know they've connected now. There was a seat, with a PRA seat for spring of 2026, which means whether it was this physician or the physician that maybe Northern Health and Council Norbury had gone through was able to get into that seat, they would be able to start in the fall of 2026, not having to wait till 2027. So I think it's important to find out if the seat was left empty, because that's concerning. And if it was filled, who filled it? Because I think if there's any PRA seats are ever left empty, it should be filling it with somebody, some community. I mean, obviously, we're looking for 2 or 3 doctors within our own community, is my understanding. Not that the number's been given to us by Northern Health, even though we've asked for it, on what it would take to get our ER after hours model reinstated, how many physicians would we need, and with Vera, we haven't gotten that number. So I think that's where this is important about that PRA seat, because I believe as we go forward, there should never be a PRA seat left open. Unless we're all full, and I have a hard time believing that when I see what Dawson Creek is going through right now. Chetwynd is fairly good. We are the state we're in, and I mean, obviously, it's going to change in Fort St. John eventually and move around. But Fort Mackenzie is in fairly good shape right now too. But they have some doctors moving out too. But to me, we should never have a PRA seat empty, ever. I mean, even if we have to bring on more doctors than we need. Councillor Julich.
I'm just wondering if anybody's talked to Mayor Rob Fraser from that area to see, I just feel like there would maybe be some frank conversation. But I see the look on your face that maybe that's not the case. So, okay, I'll just leave it at that.
Yep. So I know that PRA seat, and there was no interviews done talking with Fort Nelson. So I talked with Fort Nelson. They didn't do any interviews for doctors. They do have a doctor coming in February. My understanding is they're full. Right now, there is no patients for this new doctor coming in, is my understanding. That's why I've asked for that doctor to be rediverted to Tumbler Ridge. Maybe it's only a short stint here in Tumbler Ridge. Maybe it's only 2 or 3 months, but it sure helps us in 2 or 3 months until we can get established again. So,
Okay, no, I'm good with that.
Councilor Norbury?
Yeah, thank you, Mayor. I'm in favor of the motion. Just to give some background, Tumbler Ridge was only given 1 PRA position, and we did 2 interviews. I can only imagine that if it's similar in other communities, what if there's another community, obviously we want ours, but we interviewed 2. We could have had 2 matches. What other communities could not have, are going without a doctor because of this unclaimed seat? I think it's good to get the information back. Thanks.
Thank you. Okay, call the question. All in favor? Carried. Anything else from council? Again, thanks to all the staff and all the council and our residents. The way we're really pushing on Northern Health and the board and that to try and get reestablished. And I mean, we can't take our foot off the gas pedal. And I mean, I got lots of things inbound this week. Hopefully, I have some more information eventually. But budget's coming. So I mean, again, we got to be prepared. Personal opinion. Anything else from council in regards to this letter? Okay. Sorry. Question on spirit. Ms. Scott, any emailed in questions?
No.
Thank you. Take a resolution to a closed meeting, please. Councilor Norbury.
Thank you, Mayor. That the January 5th regular council meeting be closed to the public according to sections 90C and J from the Community Charter to permit discussions about C, labor relations or other employee relations, and J, information that is prohibited or information that if it were presented in a document would be prohibited from disclosure under Section 21 of the Freedom of Information and Protection of Privacy Act.
Seconder. Councilor Hoffman, all in favor? Carried. 5-minute recess.